Welcome to RHI's Code Blue Training Video 2024. What we're going to go over today is the roles if you're a charge nurse on a unit here at RHI, and I'm going to go over where everything is on this code card and how to use items on this code card. So let's get started. At RHI, all the code cards are set up the same. You're going to have the scribe red binder on the top, the AED defib pads, you're going to have the AED machine, you're going to have 5 drawers here: airway, medication, supplies, lab, IV, EZ-IO, mask, gown, and gloves. This drawer will have all the airway stuff. This drawer will have all the medications, and they are labeled. This will have supplies, extracurricular supplies, lab stuff. This will be your IV storage drawer. We'll have fluids you can hang, extension sets, angiocaths. This is the EZ-IO drawer. You have mask, gowns, gloves. You got a backboard for CPR, ambu bag and mask with the King Airways with the extra flow meter. You got the stool for CPR. You've got the E-tank. You've got the biohazard box and the suction setup, portable suction. That's just a quick overview of the code cart here at RHI. If you're a charge nurse at RHI, you're going to have roles during the Code Blue. If you're on Unit 1, you're going to have scribe. You're on Unit 2, you're going to have CPR. If you're on Unit 4, you're going to have AED machine. Unit 5, you're going to be in charge of EZ-IO access, IV access, and giving medications. Code Blue nursing roles for Unit 1 nursing is scribe. If you hear a Code Blue overhead, you are to respond if you are the charge nurse on days or nights from Unit 1. When you get to that Code Blue, you're to grab this red binder, and it means you're going to take notes during the Code Blue. You're going to flip to the very first tab. It's called Code Resuscitation right here. It's blue. You're going to flip that over, and you're going to grab this 2-sided page, and you're going to start taking notes. The scribe duty is to document all pertinent information during a code or rapid response. Use closed loop communication when asking for items to chart. If the receiver of the message does not hear the sender, repeat the communication until you get an answer. Also, it's important to go down the page of this Code Blue form and ask for the vitals, ventilation, medication, any AED notes, and also for rapid response items, do the same. Both forms are double-sided, and you must place a patient label on the form. It's also important to write a small narrative on the back side. That way you can transcribe it into Cerner under a progress note. This is what the form looks like up close. You're to put the people that are present, any ventilation by the respiratory therapist, any vitals by nursing. If there was any defibrillation, you put that. If there was any rhythm, you put that right here. Any medications given, you put the time and the dose. And you also want to make sure that these medications are given every 3 to 5 minutes. Sometimes there can be some confusion because the machine will say to reanalyze every 2 minutes. And just because you're reanalyzing the rhythm every 2 minutes doesn't mean that you give the medication at that time. So don't get those two confused, and make sure that you're keeping a good eye on the clock as far as 3 to 5 minutes on the medication delivery. Also important to have everyone that was in the Code Blue to sign their name, print, and their credentials. After the Code Blue is over, you're to go to the second tab and get the Code Blue evaluation form. You're to have a small huddle with the people that were involved in the Code Blue and ask if there were any problems or anything that you could do better. It's also important to have the physician included in this evaluation. Once all of these documents are filled out, you are to scan these forms to the Code Blue email listed in the copier next to the house coordinator's office in between Unit 3 and 4 in that hallway. Thank you, and that is the responsibility for your role if you are a charge nurse for Unit 1. Code Blue nursing roles for Unit 2 charge nurse is CPR. If you hear a Code Blue and you're charge nurse on Unit 2 on days or nights, you will respond to the Code Blue, and your role will be to start CPR immediately. When you get to the Code Blue, make sure you take out the backboard and you place it under the patient, and you get the stool ready if it is not already in place. You will take the backboard You will roll the patient over, put the backboard under so that you have good sturdy area for CPR. You will pull the stool out from underneath and you will place it right here, and then you will start your compressions. Whenever you arrive to the code blue and this is your role, make sure you tell the person that is doing CPR that this is your role and you're ready to take over immediately, so that the next time that they take a break, you're in line and ready to go. If the stool is not set up when you get there, set the stool up and make sure you get the backboard in place properly. You can also look on the defibrillator at your compressions. While you're doing compressions, you can actually see how good your compressions are on the defibrillator. So that gives you an idea as if you're getting good blood flow to the body. By opening the door to the defibrillator will give you a view of how good your compressions are going. Code blue nursing rolls for Unit 4 is the AED machine. If you're a charge nurse on Unit 4 on days or nights and you hear code blue overhead, you are to respond, and when you get to the code, you are to help with the AED machine. Upon entering the room, you're going to turn the AED on. You'll remove any clothing, you'll shave any hair if you need to. Plug the AED quick connect. Pull the AED defibrillator package off the top of the cart, rip it off. Pull the pads out. Then you have the quick connect. You're gonna go diamond to diamond. Then this is going to go on the rib cage as shown, and this one's going to go on the upper right chest. Connect those.
Connect electrodes.
Once connected, stop CPR, stand clear, and push analyze. Read the message out aloud. If no shock advised, check for a pulse. No pulse, continue CPR. After 2 minutes,
Connect electrodes.
which the machine will tell you when 2 minutes is, you will analyze again, and if you have to shock, it is your duty to announce stand clear and push shock button. Make sure no staff is touching the bed or the patient. During the code blue, open the AED machine door if the doctor wants to look at the heart rhythm. Once you open the door, the rhythm will come across the screen. In order to print, you will hold down the print button and it will start printing. Press the print button again and it will stop printing. Give the script to the doctor to interpret, and then give it to the scribe to put with the documentation. While waiting to analyze or shock, you can help at the code cart by handing items to the team from the drawers if needed. This is the role for Unit 4 Charge Nurse AED. Thank you. Code blue nursing roles for Unit 5 will be meds, interosseous, EZ-IO, or IV. If you are a charge nurse on Unit 5, days or nights, and you hear code blue overhead, you are to respond. Patient is conscious. You will not use EZ-IO. You will only use IV. If the patient is unconscious, you will use the EZ-IO kit, which is right here. We now have a diagram of where the access is located. Right below the patella, 2 finger lengths and 2 finger lengths to the inside. Here's the patella, 2 finger lengths below the patella, and 2 finger lengths inside. So 2 finger lengths down, 2 finger lengths inside, like a 90-degree angle, and you're there, right here. The flat spot, right there. That's your target. For those of you that have trained properly, we have left diagrams for the target location for each needle set. When you get the EZ-IO kit open, you will have the drill, you will have flushes. Once you open the kit, you will have your needle set. It's magnetized. It will magnet right onto the drill. You will have a flush. You will prime this right away with one of the salines. Make sure you prime that. Make sure it's unlocked and you prime it. There you go, primed up. Okay, it's ready to go. You will clean it. You have your little biohazard. You will hold this in order to take the top off. This is not threaded. It will just drill in once you start spinning. Once you push the point down onto the bone, you will start to drill, and you will let it go all the way in until it's flush. If you feel a pop, you have entered the cavity. Flush to the bone, you will hold it with your index finger and thumb and unscrew it. You will pull that out, put it in the biohazard, push that in, and then you will put the dressing on. The dressing will pull apart, go on just like this, pull that apart, and it will stick down to the leg. Once that's there and secure, you will take your primed extension set, and you will screw it on right here. Give 5 to 8 cc's of saline flush, then draw it back, and if you get blood marrow or blood, you have confirmed your access. You unscrew it, and you're ready for meds. After each med is given, you flush it with a 10 cc syringe. That's it. Thank you. Regulator, it should be around 1500 to 2000 psi. We're going to run this at 15 liters of flow. If you turn it and you're not getting 15, like see how it just went to red? Well, this must need to be cracked open. There we go. Now I've cracked that open and we're full at 2000 psi. So if you look up the Ambu bag, this bag needs to be filling up right here. Okay? How to properly Ambu a patient. Number one, these are in the top drawer, the bite blocks. You have multiple different sizes. The way that you tell the size is from the corner of the jaw to the lip, and that fits. So what you do is you go in upside down, and then you turn it around and you push it in. And that way it'll push the tongue back when you're ambuing. You have to inflate this, or it will not be productive. Let this go in at 15 liters, full throttle in, and then I'm gonna hold a good seal with both hands against the jaws and my thumbs like this. And then nice and easy. And you want a doctor or someone to listen for breath sounds, or we will use the CO2 checker in between to see if you're getting good airflow. Overhead page is pound 311 overhead page. Code blue, unit, room number, wait a little bit, call it over again, unit, room number, nice and clear. The two sizes of the feeding airways for 5 to 6 foot and over 6 foot. All right, instructions on insertion. It's going to be RT or the resident to insert this. All you do is you put some lube on this one and here. The more lube you put, the better. You can put 2 of them on there. So it'll slide in. Once you get the lube on there, you go in the side of the mouth all the way down, and you go the marks 15, 14, 15, and 16 right there. Blow it up, 60 mils, and check this pilot balloon. When it's super full, you know you're close. All right, that's 60, and this balloon is pretty tight. So we're going to put the CO2 checker on there and look for color change. And we're there. It's every top drawer will have a 30 cc syringe and a CO2 checker that you put in between the king and the Ambu bag to see if you're in the lungs. We'll also have a flow meter, extra tubing, Ambu mask, suction, oral suctioning, long nasal cannula, Veni mask, ABG kits, non-rebreather, ear probe. If you can't get a pulse ox, put this ear probe on. It will work with your blood pressure machine, and we have an extra one. If there's an emergency and we're not there, just pull this door open and take anything you need to get that patient some oxygen. Also, we have the bite blocks. We've got 3 different sizes. If you're going to ambu a patient, this needs to be in to move the tongue out of the way so that the air can go in. Drawer, medication drawer. Each medication is labeled. Here's our epinephrine. Rip it open. Pop them both out. You pop the tops off of them. Screw it in place right here. Once you get it screwed in, pop this off, and then you screw this in, and then you're ready to push it. You push this in. After you push it in, you flush it with a 10 cc saline syringe. That's it. That's 1 amp of epi, 1 milligram. Suction machine, power button right here. We'll hook it up to the canister. We'll hit power. Yonker. If you're not getting suction, one of these holes might not be covered. There you go. You heard the difference. Now located in gyms 1 and 2 in the center of the gym is a 50-foot O2 tubing connected to an Ambu bag and mask, and then a non-rebreather, a suction setup with Yonker. This 50-foot tubing should reach anywhere in the gym. You'll want to run it at flush all the way. Turn this up to over 15, and it will blow this bag up, and it will also blow up the non-rebreather mask. Feel free to use this anytime there's an emergency. Thank you. If you're a charge nurse, it's your responsibility to know your roles if a code blue is called. Thank you for watching.